This month is Breast Cancer Awareness Month, and being informed about this deadly disease could be life-saving. Joining me this morning is Dr. Thomas Klein, a radiation oncologist from Good Samaritan Medical Center. Thanks for taking the time to join us to talk more about what women need to do, starting with mammograms. And there's been so much talk back and forth about how frequently we should have our mammograms. What to you is the bottom line, Dr. Klein?
Right, so there's clearly been a lot of debate in our field about the timing of mammograms. From our standpoint as oncologists, women should be talking to their doctors as early as the age of 40 about getting mammograms annually. If you've gone to the age of 55 and haven't had any abnormalities, then a discussion can come into place about spreading things out a little bit more. But in general, getting your mammogram once a year is a good thing to do starting at the age of 40.
We've always been told if you feel a lump or a bump in your breast, you should get to your doctor right away. Are there other signs and symptoms that women should be aware of for breast cancer?
So again, the way the vast majority of women are diagnosed is by mammogram, but if a woman is looking for things that have changed in her breast, things like nipple discharge, nipple retraction, lumps also in the armpit, those are things that can be signs of breast cancer, but it's important to talk to your doctor about exactly what's going on.
Do you still suggest self-exams for women at home?
So the guidelines for clinical self-exams have changed quite a bit. We haven't found them to be as useful as in the past. Again, it's difficult for women to identify things as being cancerous or benign, and so what we do recommend is that if you've noticed anything that's changed over time, to bring it up with your doctor.
Are some women more susceptible to breast cancer than others?
Absolutely. So women who have a family history of breast cancer, women with known genetic abnormalities, and certain other categories of women certainly should be screened at earlier ages, and so it's important if you know that you have any of these risk factors to talk to your doctor about those things.
There's a lot of hope in treating breast cancer too. There's been some big breakthroughs. Just real briefly, what are some of the breakthroughs in treating it?
Yeah, absolutely. One of the biggest changes is the way we manage patients with the radiation aspect of their care. It used to be that all women who needed radiation were taking 5 or 6.5 weeks to get their treatment. Nowadays, we can do it during the day of surgery for many of our patients. So it's just a one-time treatment, and that's it. You're done.
That's just remarkable.
Big change.
It is such a big change. Is the awareness of women and the awareness of breast cancer, is it helping to raise the survival rate, and women are getting in with early detection and is being treated promptly?
Absolutely. So that was something that for a while we weren't seeing, but over the last few years we've actually started to see a decline in the rate of women dying from breast cancer, and we attribute a lot of that to early detection and improvements in our ability to treat breast cancer.
Get your mammograms, talk to your doctor, and let's make sure we can just get rid of this disease altogether. Thank you, Dr.
Absolutely.
Klein, for your insight and sharing the info.